commonly tested topics on the NCLEX. We'll be focusing on buzzwords and high-yield facts, questions you have to be able to answer flawlessly if you know the content. So let's get to it. If you'd like to watch this video. The nurse is caring for a client with urine output of 8 liters in 24 hours after brain surgery. Which of the following the nurse should anticipate? Test-taking strategy. Read the question from the back. Which of the following the nurse should anticipate? The nurse is caring for a client with urine output of 8 liters in 24 hours. Nobody will have urine output of 8 liters in 24 hours, except when they have a brain surgery and they have problem with ADH. To have 8 liters of urine output, you have diabetes insipidus. If you have diabetes insipidus, you're pouring out your urine just like that, right? Your serum osmolarity is going to be concentrated, right? Your urine-specific gravity is not going to be elevated. Your serum sodium will be very high, right? Because you have a lot of urine output. Therefore, you should not give them 3% normal saline. Test-taking strategy, they will need free water to dilute the sodium. First question out. Number 2, a nurse is caring for a client with SIADH. Like I said, straightforward question. Prescribe Desmopressin. What is the nurse best action? What is the nurse best action? Nurse is caring for a client with SIADH. Prescribe Desmopressin. I've underlined the buzzwords. Think about it. Best action. If you have SIADH, that means you have too much ADH. You have too much ADH. Do you need another Desmopressin, which is another ADH? That's bad. You don't need any more Desmopressin. Therefore, there's something wrong with the question. Look at the answer. Check for urine-specific gravity. Yeah, somebody with SIADH, the urine-specific gravity will be very high. Record urine output. The urine output will be decreased. Neuro check. Yeah, somebody with SIADH, you have to check neuro because they may go into seizures. But this is absolutely wrong. If you give them more ADH, their condition is going to worsen. Therefore, test-taking strategy. I see that SIADH, you should never have Desmopressin. The nurse should not be allowed to give this Desmopressin to this patient. It's contraindicatory. You're giving the patient poison. So question the prescription. I intentionally said this question so that you can think carefully about the pathophysiology of the disease process. So number 3 is the right answer. Number 3. Which of the following assessment is a priority? And this is caring for a client on magnesium drip. Whenever you're on magnesium drip, think about it. You have hypermagnesium. Your magnesium is very high. Key fact, when you're increasing magnesium, your symptoms is supposed to go down. But we don't want it to go down too much. Deep tendon reflex is supposed to go down. It's not a reflexia, right? 1 is what I expect it to go down like that. I don't expect it to be 2. It will be normal. I don't expect it to be 3. That means it's not working. So this is fine. Right? Urine output of 100 in 3 hours, right? That means you're making at least 30 ml. When you're on magnesium, you need at least 25 ml. She's doing fine. Respiratory rate of 12. Yeah, anything less than 12 is a problem. So this is good. SAT of 94. I want SAT of 95 to be a priority. And you have SATs of 94. This is your answer. So number 4 is your right answer. Question 4. Which of the following assessment is a priority? And this is caring for a client who just finished non-stress testing. What is that? NST, non-stress testing. Do you know what it is? This is what you check in the baby and the mother to see if the baby is ready for labor, right? Whether the baby is doing well. It's a well-being study, basically, to figure out if the baby is doing well. What are you looking for? Acceleration. What are the results you're looking for? Reactive non-stress test. That means when the baby is sitting there, it's not being non-stress, and you checking, you see acceleration, at least 2 acceleration within the duration of 20 minutes, right? So this is good, this is good. What is the definition of acceleration? The fetal heart rate should increase by 15 or more, not 5. 5 is not an acceleration. Therefore, this is a problem. This is a negative test. That means the baby has non-reactive, non-stress test. Acceleration of 5 is not enough. Number 3 is your answer. Number 5. Which of the following the nurse should anticipate on assessment? A nurse is caring for a client with what? Parkinson disease. You know, this is a dopamine problem. What do you see, right? Chloroform movement? No, they don't have chloroform movement. That's Huntington disease. Are their tremor essential? No. Essential tremor is the tremor you get when you're moving in action. And a subset of essential tremor is intentional. When you see something, you're going to pick it up, and then you start shaking. It's an essential tremor. Parkinson people have resting. They're not moving, but they have tremor. When they move, their tremor get better. They have mass-like face. That's good. And they shuffle their gait. So 3 and 5, 4 and 5 are your right answer. 1, 2, 3 are wrong. Select or apply. Pick those you're confident. Don't over-select. Number 6. A nurse is caring for a client with what? Parkinson disease. Which of the following prescription the nurse should question? Parkinson disease, what is the problem? Acetylcholine is high, dopamine is low. So I want to increase dopamine, decrease acetylcholine. Seleginet, what is that? It's a monoamine inhibitors. It increases monoamine. One of them is dopamine, so I don't need to question. Aripiprazole, it's a first generation antipsychotic. It blocks dopamine. Do I want to block dopamine? Low levodopa. I need dopamine. I have more dopamine here. Ropinirole is one of the dopamine agonists. Okay, so it's used in practicing. Benchtropine is an anticholinergic. You have too much acetylcholine. Anticholinergic is good. So what is your right answer? It's only one answer. That's that one. Allopurinol is your right answer. That's the only one that we need to question. Okay. Number 7. A nurse is caring for a client with acute onset of ascending symmetrical paralysis after that diarrhea episode. Keyword: which of the following need intervention? Ascending, buzzword, symmetrical paralysis after diarrhea. You have diarrhea, all of a sudden you have ascending paralysis. This is Guillain-Barre syndrome. Buzzword, I'm just using a buzzword. Which of the following need intervention? That means which one is wrong? You worry about severe lower extremities, lower leg weakness is suspected in this patient. Spastic extremities suspected. Weakness is suspected. Contact precaution, no, it's just standard precaution. Number 8. A nurse is caring for a client with Myasthenia Gravis. Which of the following need immediate intervention? Myasthenia Gravis, they have what? Acetylcholine receptors is being blocked by another antibodies, right? So you need to give them more acetylcholine. They are what? Weak during as the day progresses, but they're strong during in the morning. So excessive energy in the morning is good. Fatigue mid-afternoon is good. Severe lower leg weakness at night is good. Physical therapy at night, they weak at night. Schedule the physical therapy in the morning. So this is wrong. It's concept, concept-based questions. So for need intervention. And number 5, a nurse is caring for a client with a new brain cancer. During assessment, patient said to the nurse, "I'm being punished for my sins." What is the next best action? This is therapeutic communication. Keywords: don't talk. If you're talking, ask for more. Don't ask why question. You got this. Don't worry. Negative. You are in safe hands. No. Do you have a family member to call. That's not what the patient is asking you. Tell me more about your statement. Figure out what is going on. More information is better. Number 10. Same thing. Strategy. Which of the following is appropriate? Nurse is preparing to admit a client with what? Closed, localized, epizoster, infection at the right flank, pathway, closed, localized, epizoster. Epizoster, when it's open, it's not crusted, uncrusted, you need airborne and contact, especially if it's an immunocompromised patient. This is closed, and this is localized. We just put a gauze on top of it. We don't need airborne, standard precaution. We don't need contact. We don't need droplet. 10 questions I yield. Adapt NCLEX with content-based. Thank you for watching. Have a good day.